Hello, I am Professor José Alves, and I would like to come today and talk to you about my latest paper, which is about to be published in the International Journal of Clinical Practice, and it's called Tocilizumab: Is There Life Beyond TNF Blockade? Now, this paper, I believe it's interesting because it addresses some of the main issues that are still unmet in anti-TNF treatment regarding rheumatoid arthritis. Now, this is a major condition that afflicts millions of patients around the world, and anti-TNF, an excellent drug as it is, has been able to achieve a completely new standard in treating these patients, namely in remission, which has been quite significant with these drugs. But there are still unmet issues that have to be addressed. Some of the patients don't tolerate methotrexate, and therefore anti-TNF is a lot less efficient. And some of the patients do have extra-articular manifestations, and those are not as well treated with this kind of treatment. And even so, lots of the patients sometimes do not respond to anti-TNF, and they have to change to another kind of drug, and there are not so many options still available. So Tocilizumab, a new drug that blocks IL-6 receptor and therefore has a completely different mechanism of action, seems to be a very good alternative. It does address patients that don't tolerate methotrexate because it can be used without it. It does change the course of the extra-articular manifestations, but most of all, it has an outstanding rate of remissions. In fact, it is quite consistent around the board, either with patients that did anti-TNFs first and didn't work, or patients that have disease for more than 9-10 years. And all the studies have shown a quite impressive, stable, significant remission rate of about 30%. Even the new studies like ACT-SURE has recently shown that 18% of these patients can actually achieve remission after just one treatment, and that is just 4 weeks. When it comes to 6-month treatment, then you get numbers which go as high as 62%, and I believe that's quite impressive. So all in all, we do have already some very good drug treatments for RA, but Tocilizumab seems to be able to go the extra mile, at least in some of these important aspects. That's why I think this paper might be important, and I do hope you enjoy it. Thank you.